Namaskar dosto, welcome to channel Toxicology on Board. Today in this video we will be discussing about another topic, alternative non-animal methods for testing topical eye. So let's directly dive into the question. Here the question is alternative non-animal methods for testing the potential for chemicals to cause topical injury to the eye have been developed by an international consortium and adapted by several regulatory agencies. What animal test do these alternative methods replace? So you have to understand the questionnaire. No, their focus is more towards a 3R or 4R principle. So they are always looking for alternative methods. Any questions which are related to the recent 3R or 4R principle. So on that basis only this question is there. So as you know that they want to replace the animal testing methods with alternate methods, either it is in silico methods or in vitro or any other in silico methods also. So the option is option A, the Drake test in the case of rabbits. Option B is the Hayes test in the case of mice. Option C is Mays test in the case of rats, and option D is Gaze test in the case of primates. Okay, the right answer will be in the green text, that is option A, the Drake test in the rabbits. So let us see what is the explanation and the reference which is given by the American Board of Toxicology. The questions are taken from the ABT itself. Drace test has been the standard since the 1940s. So it is a very old method, but has been criticized in the 21st century. So those people who are might be who has a habit of reading more and more publications and articles, you might be knowing there is an article with respect to risk assessment in toxicology, 21st century. So most of the time, these kind of criticism is been mentioned in these articles by the for high interlaboratory variability. So these are the reasons why this method has been criticized, means interlaboratory variability. If you're doing in laboratory one, the results are little different from if you're doing the same test, race test in laboratory two. Okay, subjective scoring. Since if there is a toxicologist one, for him the particular reaction might appear red, but when the same reaction is being observed by second toxicologist, he might give a scoring as 3 or 4. So there is a subjective variation when they are scoring this Drage test, and poor predictive value. Even though results are getting positive or negative or based on scoring 0 to 4, still they are not able to translate it to the human this thing. So for this reason, it is a poor predictive value and for causing undue pain and distress to the test animals. So this is a major reason. That's why we are looking for alternative methods, because we do not want the animals to be subjected to unnecessary stress or pain. Okay, so when we have alternate methods, please go for other methods. So this is the question is, what is the alternate method for trace test? Okay, so the answer was a Drake test, and let us see what are the other three options which are meant for. So one option 4 was about gaze test, which was done in primates. So the gaze test is used to evaluate the ability to generate and hold the steady gaze without a drift or gaze evoking nystagmus like this. Okay, this is the test used in humans as well as in the primates. So gaze test is to evaluate steady gaze without a gaze evoked nystagmus. Okay, coming to option C, the maze test in the rats. The maze test is used to test memory. Okay, there will be FOB parameters will be done. So to test the memory, cognition, and behavior commonly in the case of rats. So you will be observing this type of test particularly in the FOB. Safety pharmacology, we have three things. One is CNS, one is respiratory system, another is your cardiovascular system. So in the case of CNS, you will be having functional observation battery test. Next, the maze test is used to test memory, cognition, I mean to say behavior, and commonly in the case of rats. And Hayes test, option B, Hayes test in mice is a method for detecting the bile salts. For detecting is a bile test in urine in any species, either it is mice, rat, rabbit, like that. So if you want to understand this particular concept, the reference which is given by the American Board of Toxicology is Casseret and Dowell, chapter number 9th edition, page number 885 to 886. So let's understand what more we can learn from this particular question. So let us understand little bit about the history of this Drage test since 1994. See, I have taken this particular paragraph from the page 885 and 886 only, ocular toxicity chapter it is. Since 1944, the standard procedures for evaluating ocular irritation were based on the traced method. So this was the first initial method in the 1940s, which we have seen in the first slide, the explanation given by the ABT. Over this time, the Drage test, with some additions and some revisions, formed the basis for safety evaluation in data submitted to several regulatory bodies. It can be either FDA, it can be European Economic Community, and several federal agencies within the United States. Okay, so one of the main reason why people kept on doing Drage test is that it is a regulatory requirement. Traditionally, albino rabbits were the subjects evaluated in the Drage test. Okay, the ideal species, the recommended species is rabbit, but you can go for other species also, but you have to give additional rationale. Although the EPA, Environmental Protection Agency protocol allows different test species to be used if sufficient justification is provided. So always, even if if you look into OECD guidelines, whether it is 407 or 4, whatever it is, they say that they will recommend one species in the guideline, but they also say that you can go for other species also, but you have to give additional rationale or justification why you are not using certain species and why you are using this particular species. The standard procedure involves installation of, if the test item is in the liquid state, 0.1 ml, if the test item is in the solid state, 100 mg, okay, into the conjunctival sac of one eye, and then gently holding the eye closed for 1 second. Okay, and the untreated eye, the next one, the untreated eye will be serving as a control. So within the same animal, one eye will be considered as treatment eye, another will be considered as control eye. Okay, both eyes are evaluated at 1 hour, 2 hour, 1 hour, 24 hour, 48 hours, 72 hours. In the case of acute 423 guideline also, you'll be 30 minutes, 60 minutes, 60 minutes, 2 hours, 4 hours, 8 hours, like this observation is there, no? So in case of this one, Drage test mein eye scoring you're doing at 1 hour, 24 hours, 48 hours, 72 hours after the treatment. If there is evidence of damage in the treated eye at 72 hours, the examination time may be extended. You can go keep the animal for another 12 hours or for 24 hours, like that. Okay, you will keep the test item in the eye for next additional hours, I'm saying. The cornea is scored for both the degree of opacity. Is there any blood unable to see opacity, opaqueness is there, and the area of the involvement, how much, and with each measure having a potential range from 0 to 4. 0 is none and 4 is the most severe. This is the scale which they have mentioned. The iris receives a single score 0 to 2 for irritation, including degree of iris scoring will be also be involving swelling, congestion, degree of reaction to the light. Cornea, iris, and conjunctiva are evaluated and scored according to the weighted scale. So this is the important point that you have to remember. I have directly taken from Clayson textbook. You can go back and read in the textbook also, or you just take a screenshot of this particular thing and remember. That will be useful for your exam. So next important in continuation, that page number 885, 886 in the Clayson. The conjunctiva is scored for the redness 0 to 3. You are seeing 0 to 4 was there, 0 to 2 scoring is there. For redness, eye scoring 0 to 2 was there, and for the conjunctiva scoring it is 0 to 2, 0 to 3. Chemosis, swelling 0 to 4, and discharge. Is there any discharge from the eye? That is 0 to 3 you are giving scoring. So the individual scores are then multiplied by a weighing factor, 5 for the cornea, 2 for the iris, and 5 for the conjunctiva. The results are summed for a maximum total of 110. This is the scoring. Okay. The photographic examples of lesions received each score are provided in the so and so reference. That's an Freeberg. Okay. In this scale, the cornea accounts for 80, that is 73% of the total possible points in accordance with the severity associated with the corneal injury. The Dray's test has been criticized due to its same points which are mentioned by the ABT also. Same it is taken. See, high interlaboratory variability, subjective nature of the scoring, poor predictive value of human irritants, most significantly for causing undue pain and distress to the test animals. So this is the explanation given by the ABT in the first slide if you see. The Interagency Coordinating Committee on the Validation of Alternative Methods ICCVAM, a committee representing 14 agencies of the federal government, okay, has evaluated alternative testing procedure to assess the potential for chemicals to cause ocular corrosivity as well as irritation. So now you have to understand that another important thing when we are going through this video to this presentation, 3 to 4 slides, what we are going to read, no, read about EPA, federal agencies, regulatory agencies are also coming into picture, no, apart in addition to the this particular content, also read about ICCBAM. Okay, what is the role, what is the purpose, how many agencies they are saying that 14 agencies are there, what are the alternative tests which are suggested by this ICCBAM, which are approved by OECD guidelines, which can be used for regulatory submission. All those things points also you read together. Okay, ICCVAM currently lists 7 such alternative testing procedures. So what are those 7? Make a list of those guidelines that have been accepted by the US regulatory agencies, adopted by the Organization for Economic Cooperation and Development OECD, and endorsed by the European Union ICCVAM 2070. Yeah, so you can go back and check this reference also, which is there in the NTP site. Again, you read about NTP, what is National Toxicology Program, what is the purpose of NTP, what kind of studies are done, and the studies, if they are done by this NTP agency, are they can be used for regulatory approval. So those things also you read simultaneously. Don't just restrict to one question. The idea behind this channel or this particular kind of teaching or discussion with you people is that we will read about the question. We'll also read about all the contents along with the but that particular question. So if any question surrounding this particular concept we'll be able to answer in the exam. Okay, so read about ICCVM, little bit of history we have seen with respect to DRACE test and what are the alternative methods. OECD alternative methods will be there, no, that one. So these are the important. In addition, I have kept for you people is that you can go back and check in the ocular toxicity chapter also, or if possible, make a screenshot of this one. So simultaneously also read about these two diagrams will be there. This one and another next slide will be there. Ocular absorption and distribution of drugs of chemicals following the topical route of exposure. So how the absorption and distribution is different from other routes like oral route or parent route, other types of routes are there, no? So just to go through this particular decision tree or flow diagram, I will say topical route of drug and chemical exposure. The flow of the drug chemical might be through tears or nasolacrimal drug. Then it will enter into the digestive system. It might reach into systemic circulation. So whenever you are applying certain chemical in your eye, it is not only causing local toxicity, it is also causing systemic toxicity. How it is entering the systemic toxicity? Either through tear or nasolacrimal duct, cornea, right? Aqueous humor, iris and ciliary body. So like this, you try to remember the this flow diagram. Okay. Also, one diagram is also given about this eye and structure, the cornea, iris, what are the different parts are there. So please read in detail. And also go through page number 884, where earlier diagram we have seen absorption and distribution. Here distribution of drugs and chemicals in the anterior and posterior segment of the eye, optic nerve, brain and other organs following the systemic route of exposure. So apart from local toxicity, once the drug is reaching through nasolacrimal tract into the systemic circulation, how the details of the movement of drugs and chemicals between compartments of the eye are discussed in the text. So here you can see the dotted lines represent what there will be. See, the solid and the dotted double line represent a different blood tissue barriers. Since you know the blood-brain barrier will be there, placental barrier will be there, cerebrospinal fluid like this will be there, no? So different blood tissue barrier in the anterior segment of the eye. Okay, this is the dotted line which represents retina, optic nerve and brain. The solid double line, these two lines are there, no? This solid double line represents tight endothelial junctions. In the brain, how we'll have in brain and spinal cord also we have tight endothelial junctions. Three different type of cells will be there, astrocytes, which are forming the endothelial junction, no? So similarly here also we have solid double line which is representing tight endothelial junctions. What is the purpose of this tight endothelial junctions is that it will not allow the passage of chemical into the particular cell. Okay, whereas the dotted double line, here it is, you know, dotted double line represent loose endothelial junctions. Okay, so try to remember this one. Different parts of this eye, corneal endothelium, aqueous humor, iris and ciliary body, vitreous humor, how it is entering into the lens. So try to remember this particular picture. Okay, So hope from this video you were able to learn about the importance of this DRACE test, little bit of history about it, about what are the alternative methods, ICCVAM, NTP, OECD guidelines. Yeah. So thank you so much. Be curious. For any questions, please comment. You can always write a mail to arya.priyanka18@gmail.com. Like, subscribe, and follow my YouTube channel, Toxicology on Board. Thank you so much. All the best for your exam.